Well, excessively long lineups and delays continue to plague many airports across this country, especially Toronto's Pearson International. Staff shortages are said to contribute to this, but the Canadian Airports Council says the other main reasons are the cumbersome COVID-19 protocols, the random testing, and health questions, for example. That is why they want them scrapped. As for the other requirement, the travel vaccine mandate, well, the council isn't calling for its removal, but has been reported as saying it's a discussion worth having. So let's continue this discussion. Joining us now with more is infectious diseases physician Dr. Sumon Chakrabarti. Doctor, welcome back to the program.
Good morning, Izzy.
So let's begin with the COVID health protocols at the airport. The Airports Council, as I mentioned, is asking for their removal. From a business perspective, of course, is resulting in a lot of frustration, a lot of inefficiencies, and then there's the medical perspective. They say, given the high vaccination rate, they're not necessary. Would you agree?
I would totally agree with that. Look, we're in a different phase of the pandemic where we have to remember in Canada, we have greater than 90% of people on the ground who are vaccinated. And let's not forget that the people who are unvaccinated are largely at this point immune, having been exposed to the virus. So when we look at these measures, what are we actually doing? I don't think we're actually doing anything that's medically useful. And it's obviously causing a lot of delay in travel, making travel very difficult. And ironically, when you have a lot of people who are crowded together, you're increasing transmission anyway. So I think that we really need to re-examine this and scrap a lot of this theater.
So let's talk about the the travel vaccine mandate. And this, in many ways, is contributing to this with the Arrive Can app and the questions that come with it. At the time when it was implemented, it was because of the high cases, and it was also the justification was to reduce transmission. As you know, science evolves. What is the science saying now?
Yeah, this is another thing that I think is important to change as well, is that the vaccine is amazing at stopping severe disease. That's one thing that we know. But unfortunately, we're seeing that it doesn't do very good at reducing transmission, especially on a population scale. So when you can't actually reduce transmission, you're basically now just keeping people who are unable to get, or who don't want to get vaccinated or unable to get vaccinated off a plane for no good medical reason. And I think that's discriminatory. So I think at this point, especially in the new phase of the pandemic, the vast majority of us are protected. I think it's time to now drop that mandate and allow people who haven't gotten the vaccine to now board planes and trains to be able to go see their loved ones.
And I'm sure you can appreciate this is a controversial opinion, and there are a couple ways of looking at that, right? When people see the waning efficacy data of 2, even the 3 shots that we've seen, some would argue that, look, perhaps they're ineffective in the long term, not worth it. Others would say this is the time to have a regular booster dose. What's your opinion on that?
Yeah, this is something that we don't actually have a lot of data on. And it's important to note that even with the 3rd dose, we do see that it benefits especially those who are older than the age of about 60 or so and certain immune compromising conditions. But we don't have good randomized prospective data showing that it's something that's good for the entire population, let alone the 4th dose. So I think it's important for us now. We're in a new phase of the pandemic. The emergency is now behind us, but it's obviously still here. We need to continue to gather good, high quality data before we make broad type of recommendations for the population on immunity, as that we're now seeing that there's certain populations that certainly we must target much more than others.
At the time as well, it's been described to me that this was to accelerate, if not encourage, vaccine uptake. Did it have that effect?
Maybe for the first little bit it did. I think there's no question that mandates do something initially up front, but in the long term, did it really get to the populations that at this point were not wanting to get the vaccine? I don't think so. And I think that we have to remember that from previous vaccine campaigns, the max that we ever got was something like 40% when you look at things like influenza. So to get 91% of people on the ground, and if you look at high risk populations in Canada, it's something more like 97 to 98%. We did a wonderful job of getting people vaccinated, but let's not forget that people who haven't been vaccinated also have a significant amount of immunity due to exposure. So we're in a very good place. I don't think we need to coerce people to get vaccinated. I think now it's time for us to move forward and realize that as a population, we're very well protected against SARS-CoV-2.
I have literally just a few seconds, but some would say that this is perhaps an irresponsible time. Are you confident that if this were to be lifted, that there wouldn't be a high uptick in numbers?
We might see some uptick, but look, this is not where the majority of transmission is happening in travel. It's happening in households and workplaces. So definitely, I think now's the time. I don't think that we're going to have anything that makes it, for example, hospitals to be overflowed. We're in a good spot. It's time to lift these restrictions.
All right, we have to leave it there. Dr. Sumon Chakrabarti, we appreciate that. Thank you, sir.